What is the most likely diagnosis? A 29-year-old woman presents to the psychiatrist, complaining of mood swings for the past 4 years. She reports having episodes of increasing energy, irritability, and impulsivity lasting for a few days, followed by periods of feeling down and having low energy, but not meeting the criteria for major depressive episodes. She has never had a manic episode or a major depressive episode, and her symptoms have not caused any significant impairment in their daily functioning. What is the most likely diagnosis? Okay, so my thought here is initially when I was reading everything is some type of bipolar disorder. And the differences, so I don't think it's cyclothymic or dysthymia or major depressive, but my thought process was between one and two. I think one is more like you have to, it's like defined by manic episodes, and two is defined by hypomanic episodes. So I would go with the bipolar two.
Okay, so talk to me. Okay, so we're gonna work through this together. So, um, what? Okay, how do I prompt you here a little bit here? So I like your train of thought. There's no mania. Okay, there's no major depressive, but there are some highs and there are some lows, right? But when you're talking about psych things, what is also another criteria that's super important in psychiatry? So you have your
Mm,
symptoms, but also they talk about what chronicity, right?
yeah. How long?
So
Oh, 4 years. Yeah.
So when they mention something in years, you got to be kind of triggered to think about things that have criteria in years. Does it make
Yeah.
sense? So what
Yeah.
have criteria in years?
So things that like, I think actually like dysthymia, I think that's in years. Cyclothymic disorder. Oh man, I don't actually remember what. So I think that bipolar disorder is like for the past like it's like months or weeks is kind of what you think about.
Okay.
Um, in cyclothymic disorder, I don't really know exactly how long that would be. Major depressive is like 2 weeks of symptoms.
Okay. Good.
Dysthymia, I think, is years. I think you're right. Um,
Okay. What do you want to go with?
I guess I'll just go with dysthymia. Dysthymia. I didn't think that at first, but okay.
So it's actually cyclothymic.
Oh
Okay.
man.
So let's talk about this, right? This is going to be super key, right? One of the things that people miss on these questions is because you're 100% right on all of your definitions for bipolar one, bipolar two, major depressive, right? Those are all correct. So people always forget about these cyclothymic versus dysthymia.
Hmm.
Okay. So it's good that we have this discussion here. So dysthymia is just like kind of sad mood for a prolonged period of time. Doesn't meet depression, but it meets kind of you shouldn't be kind of sad slash close to depressed but not depressed, right? For over 2 years. That's dysthymia. Okay, so just think of depressed mood, right? But doesn't fit major depressive disorder
For
for
more
two
than two
years,
years.
2 years or more. Yes. Okay. Cyclothymic is exactly kind of what it says. It has cycles. Okay. You're ups, you're slightly more than happy, and you're slightly sadder than sad. Does that make sense? So you're slightly outside
Mm,
of the normal range, but it goes back and forth and it lasts 2 or more years.
okay.
Does that
That's
make sense?
really I'm really glad that we had this question then because I had that, I guess, completely. I really, yeah, I didn't have that down, so that's good.
Yep, but does it make sense? It's kind of if you were looking on a mood chart, right? Depression is going to be the lowest low, like the trough is really low. Bipolars have the highest highs, right?
Mhm.
And then dysthymia is kind of a little bit more a little bit more sad than sad, but lasts 2 or more years. And then cyclothymic is kind of that cyclical, right? Cycle, right? Between sad and happy, right? That are a little bit elevated than normal over 2 or more years.
Okay, cool, cool, cool. That makes sense.